I'm Dr. Romita. I'm a plastic surgeon here in New York City. My office is located at 853 Fifth Avenue between 66th and 67th Street. I also have an office in Westwood, New Jersey, and practice at Lenox Hill Hospital in my own office-based surgery center and in a surgery center in Ordell, New Jersey. I've been practicing now since the early 1980s after completing my training in general surgery, plastic surgery, and microsurgery at NYU Medical Center. My early years were heavily based on reconstructive microsurgery and body reconstructive surgery with a component of facial and body aesthetic surgery. I specialize in most areas of plastic surgery, but have a particular interest in body recontouring in people who've lost tone of their abdomen, have excess skin and scar tissue from multiple pregnancies, weight gain, and cesarean sections. We are capable with my team of restoring figures that have had extensive weakness and distension secondary to weight loss and weight gain. I also work on patients who've had bariatric procedures, removing excess skin and recontouring the abdomen. I've developed a new suture technique which utilizes knotless, non-absorbable sutures in a triangular pattern which can completely reconstruct an abdominal wall. In the case of patients who have serious herniations or weaknesses, I work in conjunction with general surgeons, and we reconstruct the abdominal wall with mesh and remove significant amounts of excess skin and fat. Very often these procedures are combined with liposuction, and many patients undergo a drop of 3 to 4 sizes in their dresses. I also do a significant amount of breast surgery, which would include breast reduction, breast augmentation, and breast lifts with natural augmentation, utilizing the patient's own tissue whenever possible and implants when necessary. I do a great deal of facial plastic surgery, including facelifts, eyelids, and frequently restore skin contour with lasers, fat injection, and fillers. My certification is that I'm board certified in general surgery, having completed 5 years of that training at NYU. I'm board certified in plastic surgery and hold membership in the Society of Microsurgery. I'm a member of the American Society of Plastic Surgeons and the American Aesthetic Society of Plastic Surgery. I'm also a member of the New York Regional Society of Plastic Surgery and the International Society of Plastic Surgeons. All these societies are open strictly to board certified plastic surgeons. I perform many procedures here in my office where I have a level C certified operating room, and patients can recover overnight with a private duty nurse. Most operations are done under general or sedation as far as anesthesia is concerned. The more significant procedures are done either at Lenox Hill Hospital here in Manhattan or in the surgery center in Ordell, New Jersey under general anesthesia, where the patient is kept overnight in a freestanding recovery facility. Contrary to popular belief, many of these procedures can be covered by insurance if the patient is symptomatic. Overly large breast can be covered by insurance if the patient has out-of-network benefits, and we document symptomatology of the overly large breasts. Reduction of those frequently corrects the entire symptomatology. Abdominal wall reconstruction can be done repairing the abdominal wall, especially when there's a clinically obvious hernia. And at the same time, we approach this through an incision, which allows us to remove excess skin and fat from the abdominal wall. Part of these procedures can be covered by insurance with out-of-network benefits. Insurance can also be used for nasal septal deviations if we could document airway problems and deformities, and even breast augmentations, which are complications of breast augmentations resulting from capsule formation or ruptured implants, can often be covered by insurance. The only way to be certain is to come to the office for a consultation and have your insurance situation reviewed, and my medical billing company determine whether or not insurance benefits apply. I would like to demonstrate some of the procedures we do more commonly. We probably have the largest series of extensive recontouring and reconstruction in significantly overweight patients. These results are long-lasting, and some of the patients come back after 10 years still looking very, very good. The office's convenient location on 853 Fifth Avenue between 66th and 67th Street has adequate parking immediately around the corner on 67th and 5th, and is easy access for most public transportation. Within my office, we are able to perform most procedures which do not require hospitalization, and we are equipped to perform many laser procedures, including laser resurfacing, removal of wrinkles, removal of pigmented scars, as well as veins and hair. I have 2 estheticians on my staff who are experts with laser hair removal and sophisticated skincare. We also have an LPG machine for cellulite, which is still the gold standard and without a doubt the best therapist in New York with that machine. In the back, we have a full operating suite, which is considered a level 3 by Quad ASF certification, and this allows us to use general anesthesia for most liposuction cases, facial cases, eyelid cases, rhinoplasty cases, and breast cases. We're even able to do abdominoplasties here in not overly large or high-risk patients. I also work with a dermatologist, Dr. Soren White, who has multiple technologies for correction of cellulite as well as minimally invasive ways of tightening the skin. I perform injections with fillers and paralytic agents such as Botox, and I'm also highly experienced in autologous fat injection, harvesting fat from the patient's body and augmenting the face, breast, or other areas, including buttock, which needs to be augmented. The operating room is fully certified and staffed. We maintain state-of-the-art sterilization equipment. We also have an emergency handicapped entrance in the back should the need arise to evacuate patients, which fortunately has never had to happen. Early situations, liposuction alone, utilizing the safe technique of power cannulas, can be used to correct localized fat deposits, which are creating abnormalities in an otherwise satisfactory figure. The results are safe, effective, and the fat from the areas where it's removed does not return. However, if a patient gains weight, they will put weight on in other areas. These are some examples of young women who had localized areas of fat which were effectively removed and the figure recontoured with liposuction. This next patient was a size 2, but was unhappy with areas of localized fat deposit in the buttock and hip area. Following the removal of a certain amount of fat with a tiny cannula, you could see that her figure was significantly improved even at a size 2. Another patient who was a size 2 with concerns about localized fat deposits, by careful and precise liposculpture with microcannulas, her ideal figure was revealed and the patient was extremely pleased with the result. Very often in the area now of enhanced buttock surgery with fat transfers and implants in the buttock, most women are desire or are cognizant of appropriate contour of the buttocks. Very often, the buttock is camouflaged by localized fat deposits around the buttock, when once removed, yield a very satisfactory result. As you can see in this photograph, the simple removal of fat from judicious areas has yielded a very believable buttock enhancement with no injections. Liposuction is also adaptable to men. And as you can see from these photos, even an athletic person who's watching his diet still has problems with localized fat deposits in the lower abdomen. By simple removal with a liposuction cannula, these deposits are gone for good. The traditional tummy tuck or abdominoplasty is very useful in women who have smaller defects or have significant stretch marks. In this case, the abdominal wall can be reconstructed quite nicely and the offensive or annoying amounts of skin removed. These are women who have not had multiple pregnancies but who have had certain situations following pregnancy which encourage them to improve their figure. However, occasionally there's a significant amount of skin excess and localized fat deposit in someone who's had hysterectomy and multiple C-sections, and with the appropriate surgery and fitness program afterwards, the abnormal figure can be restored to pre-pregnancy status. This is the same patient viewed from the side, and you can see that the incision is low in the area of a two-piece bathing suit, but the results are very, very effective. This photo is another example of a rather extreme makeover in a woman who not only had several children with a significant weakness in her abdominal wall and bulging of the musculature, but also excessive subcutaneous fat and skin. This is her 4 months after the surgery, and you can see the dramatic reduction in size, which would not have been possible with conservative methods. Only an abdominal wall reconstruction and liposuction would be combined to recreate this figure. In this case, the patient's abdominal wall defect was significant enough to warrant coverage by insurance. The photo on the right is computer generated. There's a preoperative photo showing a computer synthesized potential result of the nose. The photo on the left. The photo on the right is showing the actual result 4 months after the surgery. So as you can see, even though we try to create a computer generated result, the actual results are far better than what we can do on the computer. In a similar situation, a young woman who had a corrective rhinoplasty. The most important aspect of rhinoplasty is to achieve a completely natural result. It should never appear that the nose was operated on, but only that the patient was born with a good nose. This gentleman required almost a complete nasal reconstruction with a very badly deviated septum and a deformed tip and nasal structure. In this case, the technique of open rhinoplasty was used with suture reconstruction of the cartilages, trimming of the cartilages, and narrowing the bones, as well as cartilage grafting. This significantly improved the appearance of his nose and also improved his function in breathing. This is yet another example of restoration of the buttock area following liposuction. In this case, a portion of the fat was reintroduced into the gluteal region to further increase and improve the appearance and contour of the buttock. With the latest generation of breast implants, the breast can be corrected even if there's a small amount of droop to the breast with a simple incision either under the breast or around the nipple. Now with the shaped form stable implants, we have the potential of placing the implant above the muscle and eliminating a lot of the problems which a submuscular placement would cause. Part of the technique is called composite augmentation, where fat is used to augment the periphery of the implant under the skin, and therefore avoiding a submuscular placement, which can lead to displacement problems of the implants later on. Breast reduction can be accomplished with a simple vertical scar and an adequate lift to the breast with restoration of breast shape. Very often the breast can be enhanced by transposing the patient's own breast tissue to different portions of the breast and creating a far better breast projection. Breasts are not desirable in men, and some men, despite weight loss, still have problems with prominent breasts called gynecomastia. A simple liposuction procedure can correct this problem essentially permanently. If there's too much skin, then a skin resection will have to be done, but in most cases this can be done with liposuction alone and removal of the glandular tissue through the liposuction incision, which is only several millimeters long. Facelifting has advanced dramatically, and the results can be obvious in as little as 10 days. This is a lady who only had 10 days to recover before going back to work, and as you can see, there's been a significant improvement in her facial contour and appearance of her eyes. This is the same lady from the lateral view, and you can see her neck has been significantly improved. And these results have tremendous longevity because of our new suture techniques with barbed sutures and muscle plication technologies. Now, fat augmentation has been added to the cheekbone and marionette areas around the mouth for a very, very significant improvement. Sometimes a mini lift can be designed, even in a 38-year-old, which can correct hollowness under the cheeks and sagginess around the jawline. Currently, we are augmenting these operations with autologous, or the patient's own fat, placed over the cheekbones to even further improve the overall result. In breast augmentation, using the latest generation of silicone implants, a very natural result can be achieved because, without creating an artificial appearance because of the significantly improved number and size of breast implants. Nowadays, a patient can be carefully measured, and an implant which fits perfectly under that breast tissue can be ordered and placed. Occasionally a size was used to determine the appropriate size and the correct implant is selected, but at that point the shape of the breast fills out only the skin envelope which is necessary to fill out. Even very large breasts in young women can be dealt with effectively with the appropriate planned breast reduction technique. What is desired is to create adequate projection and volume and a natural appearance of the breast. Occasionally, droopy breasts need both to be lifted and augmented. In this particular case, the breasts were lifted and an implant was inserted and the extra skin was removed, yielding a very natural result.